So we're going to start this webinar today, in which we will explain our vision for the next 5 years and how we have come to create a strategic plan that will try to strengthen the existing healthcare infrastructure in the Coachella Valley and bring the best healthcare possible to our residents. The first slide we have talks about the mission of the Desert Healthcare District, which, as most of you know, was created in the 1940s. And it was initially designed or created to run the hospital that we know as Desert Regional Medical Center. And since 1997, we have been working more as a health foundation, as we retain the Desert Regional Medical Center as the main asset of the district. However, we do not operate the hospital. There is a private operator, that's Tenet Healthcare Corporation, and the funds that we have, we utilize it as a health foundation to provide financial support to local nonprofit organizations and government entities that work to improve the health outcomes of our Coachella Valley residents. For most of our history, the Desert Healthcare District was limited to the west part of the Coachella Valley. That has been historically our area of, our area of focus, and it was changed a couple of years ago in 2018, well, 4 years now, and we now cover the entire Coachella Valley. Therefore, we have made a few changes to reflect those transformation points that have happened in recent history for the Desert Healthcare District. First of all, our funding covers the entire Coachella Valley. Our mission statement has remained the same, which is to achieve optimal health at all stages of life for all district residents. And our vision statement has changed a little bit. We have included equitably in part of our vision statement. And equity, we believe it is very, very important, and we will continue to push as we started doing this equity lens application a couple years ago, because it's not enough to have a wonderful hospital that provides the best quality of care possible, when we know that thousands and thousands of residents in the Coachella Valley have limited access to healthcare, and many of them have very poor health outcomes. We have to promote equity, and we have to infuse equity in everything that we do to remove the barriers that today prevent many of our residents from accessing the healthcare that they need, that they demand, and that they deserve. So with this, I would like to invite Megan Caney to guide us through the needs assessment and how we got to the strategic plan that we are unveiling to you today. Megan, please.
Good morning, everyone. Going off of what Conrado said, with the 2018 expansion moving us into cover the entire West and East Valley, there was a lot of changes demographically, geographically, and we wanted to really understand the changes that came to be with the health priorities. So with that, in the early 2020, we did commission a Coachella Valley Health Needs Assessments to really better understand this for ourselves and for other organizations in the community, so we can effectively collaborate and figure out how to best allocate our resources and track various impact. And the goal of this was really to make it a resident-driven approach, understanding various impacts of social determinants of health, uplifting inequalities, and then looking at that comprehensive collective approach. With this being in early 2020, that did come with the pandemic, so that made the process a little bit longer than it was anticipated, but over 18 months, we did the best we could in the times to try to prioritize the health needs. We made the timeline a little longer than anticipated because we really wanted to capture that community voice, which took some innovative thinking on the district's level, as well as our consultant, Hark, who went through this Coachella Valley needs assessment. So through the 18 months, we looked at 3 sources of information. On the back burner was the data reports, looking at secondary data indicators from various sources, from hospitals to the county to local organizations in our valley. And then we had some internal and external reviewers kind of dive deep and see what needs were prioritized based on that data. But more importantly, we really dove into the community engagement. And this was a 2-part process. We looked at focus groups with local leaders, from high leadership to boots on the ground, from the West to the East Valley. We had held various focus groups in different areas like housing and homelessness and education and health. We had over 30 leaders join us and really dive into what their organizations were focused on, what they're seeing in their geographic areas that they serve. And then the largest component that we focused on that had to be a little creative in this process was the community focus groups. We held 40 of these, both in English and Spanish, and offered incentives to show the community really valued their participation. And these were held in early fall in 2020. And we had just over 200 community members participate in this process to voice their concerns with their the area, what they're seeing, what they're personally being impacted by. And then we really compiled all of these 3 sources to identify top 5 health needs. These are listed alphabetically because those sources are not really easily merged. We prioritized and then list them alphabetically. And I came out with access to healthcare, economic stability, education access and quality, environment, and mental health. We do want to note that within the 40 focus groups with those 200 residents, that access to healthcare was their highest priority. So I did want to make a note in that because that was a large part that played into our strategic plan. And before I hand it back to Conrado, we just wanted to show that through this 18-month process, this really helped to inform our strategic plan process and the conversations that we could bring back to our board of directors, who ultimately approved our 2021-26 strategic plan in October of 21. And this strategic plan encompasses, like Conrado mentioned, the entire Coachella Valley from east to west. And we really use this needs assessment to try to have those health priorities that aren't specific to one area. And within the strategic plan, as Conrado will go through, we had 7 goals with various priority levels. So I will hand it back over to him.
Thank you, Megan. So here's the goal number 1, to proactively increase the financial resources of the Desa Healthcare District and foundations to apply support for community health needs. This is primarily an internal goal. These are things that we need to accomplish internally, but I believe it's important for transparency purposes that the community knows that we're working toward these goals. The first strategy that it's important to highlight is we have to renegotiate what's going to happen with Desa Regional Medical Center. As I mentioned earlier, it is our main asset, and it should remain a community asset to allow access to healthcare at the hospital level for all the residents in our community, and also to establish and support, nurture, and grow a number of partnerships that we already have in place, and to utilize our foundation dollars to leverage, to attract additional funding from outside sources so that we can maximize the investment in our communities and re-grant those dollars to local agencies. The second high priority goal is to expand community access to primary care and specialty care services. And as a healthcare district, this is a critical component of what we do. Therefore, we know that strengthening the existing healthcare infrastructure, building a more equitable primary care services and allowing access to healthcare services for people that traditionally have had limited access to these services. It's very important to the district, and that is in response to the needs that our community has set to us. All these goals are in response to the community health needs assessment. We wanted to elevate the voices of our community members, and all these goals, this strategic plan as a whole, is in response to those voices that were elevated, captured, and heard. So here we have a number of strategies. Most of them are very high priority, with exception of 2.5 and 2.6 that are moderate strategies. The first one is to provide funding to increase the number of primary care and specialty services. That means clinicians, physicians, PAs, nurses, nurse practitioners, etc. The second one is to support the number of clinics that we have in our community, primarily federally qualified health centers, community clinics, and multi-purpose community centers in geographically targeted markets. Also to expand the number of hours and the number of days that they provide services as a way to facilitate access to those services, to those centers, at times when people are more available to participate in those services, not only from a traditional 8 to 5 that we know works for some people, but there is a population that works during those hours that is unable to take advantage of those services that may be available to them. The third one is to provide support and to evaluate how community organizations are providing expanded mobile primary and specialty care services. And also the fourth one is related to telehealth services. These are also modalities that are going to allow certain populations to have access to healthcare that today we don't have that capacity in the Coachella Valley. So mobile services and telehealth services are two of those high priority strategies that we will be supporting. 5 and 6 is to collaborate, partner with culturally competent training programs to expand primary care residency and nursing programs that require retention initiatives. You know that we have a shortage of healthcare professionals in the Coachella Valley, and we want to explore every venue we have to make sure that we are attracting, we are retaining, and that we are incentivizing those professionals to be here in the Coachella Valley to provide services to our residents. Number 6 is to collaborate or partner with our county public health department on increasing the number of public health initiatives, including but not limited to COVID-19, obesity, sex education, drug use, drug addiction, nutrition, etc. And the last one is to utilize an equity lens to expand services and resources to underserved communities. And a component of that relates to promotoras and community health workers, and we want to increase the number of those professionals that are providing services in our traditionally underserved and underrepresented communities. They provide culturally competent services, they're community leaders, and they're very well respected by our residents. Our next slide is going to speak to the performance measures, and I will ask Megan to guide us through this couple of slides. Please, Megan.
Yes, so just going off of what Conrado said with the strategies, I won't go into the detail of every single one because that'll be a little bit much. We will have a reference document on our main grants page by next Monday that will allow you to see this for yourself, see the details, and get that information there. But within each of the strategies that Conrado was going over, we have about 3 to 7 performance measures that the district came up with to help try to track our impact and our funding and just make sure that we're using our resources and time to reach the most residents possible. So under each strategy, we have performance measures that look a little bit different. I'll just give a couple of examples. For the first one, looking at increasing the primary care and specialty professionals, we're looking at the residency and fellowship positions, building our relationships with the school, seeing how we can bring those positions more into the valley, as well as looking at things like scholarships to students who are pursuing healthcare in this related field. Also looking at our mobile unit strategy 2.3, looking at not only the number of additional units we can bring into operation, but those access points that they create in these geographically underserved areas that maybe not have had this readily available to them before. And then looking outside that, what Conrado was mentioning, that traditional business hours, looking to see what we can get on weekends with these mobile units or outside those hours. There's quite a few strategies, so I won't go into depth with each one, but talking about the collaborative process with Riverside University Health Systems, tracking the number that we have, and also every time we come up with an initiative, tracking the direct and indirect services that we're able to provide within each one of those. And then for the 2.7, looking at the equity lens to expand services and resources in underserved communities, we're looking at not only can we connect residents to direct services, preventative care and such, but also the resources that they need to get those direct services, such as transportation or insurance enrollment, education, and items like that. So under each one, like I said, there's about 3 to 7, and these performance measures are for our highest priority goals right now, 2, and then 3, which Conrado will be touching on next.
Thank you, Megan. Goal number 3 relates to something that we all know it's critical, especially during the pandemic. We have learned that many of our community residents have had a profound impact on their mental health, on their mental wellness. And it is important that we build the infrastructure, the programs and services that facilitate access to these services and that enhances the mental well-being of our community residents. The first strategy of goal number 3, which is to expand community access to behavioral mental health services, is providing funding to support and increasing the number of behavioral mental health professionals that we have in the Coachella Valley. The second one is to provide funding to community-based organizations to support an increase in the number of days and hours of operation of behavioral and mental health services. The third goal is to provide funding to community-based organizations, enabling an increase in the number and the geographic dispersion of sites providing services, considering co-location with other health services, and ideally an integration of primary care and behavioral health services. Number 4, to provide funding support to community-based organizations providing telehealth services for behavioral mental health services. And 5 and 6, to work with new private psychiatric and community hospital to identify opportunities to collaborate on the delivery of community-based mental health services and educate community residents on available behavioral mental health resources. And the last goal that we have, or the last strategy we have on goal number 3, is to collaborate, partner with community providers to enhance access to culturally sensitive behavioral health, mental health services. So as you see, this is all related to behavioral mental health services and to promote mental wellness in our community. For many of you, it's known that we already have made significant steps toward creating a mental health program here at the Desert Healthcare District and Foundation. We have a mental health initiative that has already allocated over $2 million. And over the next 5 years, there will be much more that will be allocated for this initiative. And to explain how we're going to measure the impact of our funding. I will invite again Megan to walk us through the performance measures.
So for this goal, we have some similar performance measures as to goal 2, specifically looking at 3.1, increasing the number of professionals. Again, we're looking at that residency, intern, and fellowship opportunity to try to increase the workforce, as well as get scholarships to students who, may want to leave the Valley to get educated, but are really focused on coming back to the Valley and serving the community in which they grew up in. Looking at the number of days of an operation for behavioral health services, again, focusing on the traditional outside of traditional business hours, addressing barriers to access the transportation issue in the geographic targeted markets, as well as just the simple connecting people to these services in a more efficient manner by working with various community-based organizations. Just another quick example is looking at the educating community, residents on available behavioral mental health, although there are quite a few gaps that we are working to address along with a lot of other organizations. There are also a lot that's available that not everyone is completely aware of. So we have some performance measures trying to target that, looking at community awareness events, indirect and direct, whether it's health fairs we participate, or reaching people through flyers, social media campaigns and such, and then connecting them back to those direct services as well. And then our last performance measure under our strategy for our highest priority goal is looking at that collaborative partnership opportunity, again, focusing on the culturally sensitive behavioral mental health services and how we can enhance those and really get them out to the community, and tracking some basic things, just number of individuals who receive this culturally sensitive, who are more, we were able to address those barriers that prevent people from going to those places like language and such. And so having that cultural sensitive material available for them, and then just simply the number of individuals who were connected to these cultural sensitive services. And I'll hand it back over to Conrado to handle our moderate priority goals.
Thank you, Megan. The goal number 4 speaks to what Megan has explained already, which is the performance measures. It is really strengthening the Desert Healthcare District's ability to measure and evaluate the impact of our funding in the health of our community members. So this goal is to proactively measure and evaluate the impact of DHCD and foundation programs and services on the health of our community residents. We are already working toward achieving this goal. As you saw in Megan's presentations, we have already identified some of those performance metrics, and we will be measuring everything that we do that has a direct impact on health services and health outcomes in our residents. The first one, and I am mentioning this, although it's an internal goal, it is important for our grantees to know that they will be participating in these types of activities, because if you receive a grant from the Desert Healthcare District, very likely you will have to report your services through the Clear Impact platform that we have adopted. So you see that the strategy number 1 is to adopt Clear Impact performance management and results-based accountability platform to track and report impact. This is already something that we have done. We have a platform in which our grantees will be reporting their progress. Second one is to evaluate the potential of offer multi-year grants to organizations. This is also a change from our previous way of providing support to our local agency. We used to have only 1-year grants. We understand that creating impact and measuring the impact of our programs requires more time, that we cannot accomplish everything in 12 months. Therefore, we want to expand to have multi-year grants. Number 3 is to require, where appropriate, grantees to conduct and report the results of patient satisfaction surveys. So that will be important to know how our community members are welcoming, receiving, and accepting the services that are provided or offered to them. Number 4 will be to conduct another community health needs assessment in 5 years. That's going to be in 2026. Number 5, to have an annual report in which we can talk about our funded programs and services and our progress toward meeting identified community health needs. And finally, number 6 is going to be supporting local organizations' capacity building efforts. So there are some agencies that are in need of having capacity building in order to provide better services, expand their services. We will be making some considerations for agencies that meet the demands, the needs of our new strategic plan, and that are working toward those, especially the high priority goals, so that we can provide the financial support that some agencies might need in order to be stronger and more able to provide those services to our local residents. Next slide. So now we will have the 3 last goals. These are all moderate priority goals, and they speak to economic stability, the environment, and education. These are needs that were highlighted by our community residents. However, because we are a healthcare district, our main priority will be to strengthen the healthcare infrastructure, to create better healthcare services, healthcare programs, and to improve the health outcomes of our community members. We understand, we value, we acknowledge that social determinants of health are important. We know that economic stability, we know that the environment, and we know that education are important components of the social determinants of health. Therefore, they have been contemplated and integrated into our strategic plan, but they enjoy a moderate priority. Our high priority and most of our funding, the prioritization of our funding and having expedited results in being funded will be targeting toward those services that have to do with primary care services, specialty care services, and behavioral mental health services. So for these 3 last goals, we have on a situational basis. That means we don't know how, it has to be defined, and we don't even have performance metrics that we have identified yet. We may play a role in raising awareness, facilitating progress on the social determinants of health specific to homelessness of community residents, to be a catalyst for community organizations to act in implementing solutions. Number 2 is going to be on a situational basis, again, play a role in raising awareness on the social determinants of health specific to affordable housing for community residents, and to be a catalyst for community organizations to act in implementing solutions. Number 5.3, on a situational basis, play a role in raising awareness of facilitating progress on the social determinants of health specific to poverty among community residents. And the last one is to promote health action planning and co-location of healthcare services in affordable housing development. Therefore, if we have an ask before the district that relates to affordable housing, homelessness, etc., we're going to try to incorporate that health action planning component into those solutions that will be proposed. The next goal, number 6, which relates to enhancing the environment. We know that the environment has a profound impact on health outcomes, but we also have to realize that our mission as a healthcare district is to have a strong healthcare infrastructure. Therefore, this goal number 6 is to be responsive to and supportive of selected community initiatives that enhance the environment in the district service area. Strategy number 1 is to play a role in raising awareness of the impact of air quality in the East Coachella Valley on the health of community residents and to be a catalyst for community organizations to act in implementing solutions. Number 6.2, to play a role in raising awareness of the impact of poor water quality in Eastern Coachella Valley. And number 6.3, collaborate with and support public organizations in the Coachella Valley to address social determinants of health related to the environment, air quality, water quality, and shelter. Finally, our goal number 7 is to be responsive and supportive of selected community initiatives that enhance the general education of the district residents. The strategies there are 2. The number 1 is to play a role in raising awareness of the impact of general health education on the health of community residents and to be a catalyst for community organizations to act in implementing solutions. Education, including the Connect IE platform and other resources. It's one that we have highlighted. And number 2, it's to play a role in raising awareness of the impact of school resources on the community residents and to be a catalyst for community organizations to act in implementing solutions. This speaks sometimes to the intersection of health and the education. I believe that schools are a gateway to many healthcare services. And when we receive something from a health, for an education institution that is looking at enhancing education through health services, that will be considered. Again, we have very high priorities, and those are related to primary care, specialty care, and behavioral health services. That concludes the 7 goals, strategic goals that we have. And we will now guide you through what's going to be moving forward the grant making process that we have established and refined here at the Desert Healthcare District. So to that, I will invite Donna Craig to walk us through this portion.
Good morning. Thank you, Conrado. Yes, as you know, we've had this board-approved grant process flow chart for a number of years now, but we have streamlined it in some respects that we will not be requiring an LOI anymore, but will be an initial application, which is actually a full application. And with that will be all the required documents that would accompany the grant application, whether it be financials or MOUs or letters of support, project budgets, all the things that be necessary for the grants team to actually review your application as a whole process. So like I said, much hasn't changed. We still have an internal review with the grants team. You can see there in the box that we would be reviewing the application in the packet and determining whether or not to go forward or to, based on what the application is about, to send a letter of declination if necessary or if appropriate. A proposal conference would then follow after the internal review. That could also include a site visit. As you know, for 2 years, we didn't really do site visits because of COVID and keeping our social distancing. After that, if there needs to be some changes in your application, we would be possibly resubmitting the application for republishing, and you would be submitting a final application, which most likely won't be changing much unless there's some ideas or some suggestions the grants team has made. Then again, it goes to program committee, which is consistent of 3 board members. We meet on the second Tuesday of every month, and they review the grant as well, look at the grants team recommendations. They would either then recommend the grant for approval or change on some conditions or actually decline it. And then that would go to the board members at their monthly meeting on the 4th Tuesday of every month. If it gets approved, then a grant contract will be finalized. And you can see on the left-hand side, again, as what Conrado had been emphasizing, that the high priority goals 2 and 3 for the grant application process, as we look at the strong healthcare infrastructure and to be able to do that in 5 years. So with that, I'm going to turn it to Alejandro, who's going to give you a quick website tutorial how our pages have changed in some respects to make it easier and streamlined for you to be able to submit a grant. And the timing of the submission, the review and approval should also be expedited with this flowchart process.
Wonderful. Thank you, Donna. Good morning, everybody. Just wanted to share, our streamlined process and where you could find, links and, information and supporting documents for our grants process. So everything is, I'll share my screen here. Everything is housed in our website. There are two ways to get access into our grants program information. The one you could see on the top here, we have the banner that has grants. So you could click on that. That's one way of reaching the information. The other way is by our menu. We also have a drop-down menu here. If you click on grants, it's going to take you to your grants page, which is the main page where we have information. If you're a current grantee and if you need access to your our grants software portal, that would be it. And if you're looking to just do some research and you want to get some information about recent grants that we have provided to local community-based organizations, you'll be able to find them there. And I'll go through each one of them so you guys can see exactly what it looks like. So let's start with a grant program. So we'll click on that. And some of these pages and links are going to be updated. So we'll have some updated, but the majority of the information will remain the same. There'll just be some small changes here in the next couple of days that we'll be updating with our website developer. As you've heard, some information, very important information, is housed here within our grants program page. The first thing is our grants policy and our grant policy number, which is OP/5. You'll be able to click here if you want to have some good reading. You'll click it here and it'll provide you our detailed board approved grants policy. Another resource here is our prevailing wage law. Okay, we are a quasi-government entity, so there are some prevailing wage laws protocols that we have to abide by, and that information once again it's here, and you'll be able to find additional information by following this link that we have here. But one of the most important things that we discuss as a grants team, it is California Assembly Bill 2019. Prior to the implementation of AB 2019, potential grantees were able to reach out to grants team members and reach out to them and ask some questions about potential program or service that they were possibly interested in getting funded. Well, that's no longer the case, and that is because of AB 2019. So our current grant teams cannot have any communication about a potential grant application that you might be thinking about submitting to us at the Desert Healthcare District and Foundation. So the first step, in order for us to engage in any kind of communication with any potential grantee, has to be the submission of a grant application. Once we receive that grant application as a team, we're able to reach out and schedule a meeting, site visit, and all of those things that Donna highlighted in the flow chart prior to me talking to y'all. So that's very important to keep in mind, that we cannot engage in any communication via email, via phone calls, without a grant application being submitted first. So we have to follow our law, which is AB 2019. And so here's some of the details within AB 2019. So who is eligible? So any 501c3 nonprofit and tax-exempt organization, a governmental, tribal, or public entity, including healthcare service providers such as federally qualified health centers and local clinics. And then here we have a list of who is not eligible. So we have individuals, endowment campaigns, retirement of debt, annual campaigns, fundraising event or expenses related to fundraising, programs that publicize or promote any religion, sect, or deny services to potential beneficiaries based upon religious beliefs, political campaigns or other partisan political activities, including lobbying public officials, unfunded government mandates, replacement funds to allow funding to be shifted to other programs or budget areas prior to grant approval, organizations that discriminate against certain groups or individuals in the delivery of programs and services based on race, religion, national origin, gender, age, sexual orientation, or disability. And then some of the requirements, really basic, 3 requirements is the organizations must directly serve residents of the Desert Healthcare District and within our geographical boundaries that encompass all of the Coachella Valley. Organization must address one of the 7 goals in the Desert Healthcare District's 2021-2026 strategic plan that Conrado and Megan went over. And then, except for many grant recipients, organizations must have current audited financial statements. Okay, so those are basic information on our grants page. Here on the left-hand side, you'll have the 7 goals that we discussed in our presentation earlier. If you want some little bit more information, these have hyperlinks to kind of give you a little bit more information about our strategic goals and strategies. And if you wish to apply to either a grant or a mini grant, you'll be able to directly from this page, be able to click on this and it'll take you directly into our grants management software. Most of you already have, if you have received the grant from the Desert Healthcare District and Foundation, you already have you're already enrolled in our grants management software, which is Blackbaud. If you haven't, it's going to ask you to set up a new profile, and then you'll be able to continue on. But if you have been, a previous awardee from the Desert Healthcare District and Foundation, your credentials are still up to date, and you'll be able to use those to log on and start the application process for both a grant and a mini grant. Okay. And in addition to that, we also have, some current grantees tab, like I mentioned. So if you want to go in and, do a report, or you want to, continue the application once you started it, you'll be able to just click on that link. Once again, that's under grants program, which is current grantees. And you'll be able to click directly on here, and it's going to take you directly to the login page for our grants management software. And then lastly, like I mentioned, if you want to do some research and see what we have previously funded, here you'll be able to see a great pictures of Ulysses S. Grant, which is a little kind of clever from our website developer. And then you'll be able to see some of our list of previous awardees, the amount and when they were awarded, and then the name of their, the description of their grant that was awarded from us. So that's pretty much it. Like I said, there's very easy ways to get access to what I just showed you. So once again, here in the blue ribbon, you could click on grants and it'll take you directly to what I just showed you. Okay, all of this information, or on a drop-down menu, you also have access to 2 other things, which are current grantees. You want to log into your portal, or if you want to see some of the grants that we had previously awarded, you could also access it through there. So very easy and straightforward. And we're always here to help out. If you have, sometimes there's staff turnover at your organizations, or the grant writer is no longer on board. So we're able to, if you don't have those credentials that are up to date, or you forgot your password, you could always reach out to us and we'll be able to help you reset those passwords and send you a link, to update those credentials so that individual is no longer within your organization that had previous access to our grants management software. So with that, I believe I'll go ahead and kick it back to our moderator, and they'll be able to continue. Great. So like I mentioned, if you have any questions, we'll open it up here for questions from our attendees. But if you have any questions regarding, the grants management software, and if you need access to it, reset a password, etc., you could always email us at info@dhcd.org, and we'll try to get to you as quickly as possible. Great. Okay.
I suppose we'll have our Q&A at this time. We do have a couple of questions in the Q&A, and we have one that's in the chat we'll also get to. But if you had any other questions, you can certainly use the raise your hand button to ask those questions. And Jeff Taylor, who was with HARP, he had to leave our meeting, but his first question is, were any other languages considered like ASL or Mexican indigenous languages? And I'm assuming that he's referring to when the strategic plan was put together by the board and when we had the focus groups and all those different occasions that occurred.
I believe the answer to his question is yes. We had several focus groups that were conducted in Spanish, and we know that we have some significant presence of the Purépecha community, and also representatives from that community participated in focus groups, and they informed the development of the community health needs assessment.
Great, thank you. Our next question is from an anonymous attendee. It seems that the inability to discuss anything with potential grantees substantially distracts from opportunities to create partnerships and work together in a collegial fashion. Is there an alternative?
I'm sorry, Andrea, I have a helicopter right behind my office window. If you give me one moment, the helicopter will land and I will be able to hear your question. Let's try now.
Okay, sure. And I assume this question is related to our assembly bill as it relates to grants, and it's from an anonymous attendee. And the person asked, it seems that the inability to discuss anything with potential grantees substantially distracts from opportunities to create partnerships and work together in a collegial fashion. Is there an alternative?
We disagree with that perspective. I think we have a process that is fair, is transparent, and it allows everyone in our community who is interested in applying to one of our funding opportunities to have a conversation with the staff once that application has been submitted. That guarantees transparency in the process, fairness in the process, and equity in this process. That doesn't deter or prevent the district from identifying strategic opportunities. Those strategic opportunities are ideally presented through the existing partnerships that we have. We have a broad presence in our community. We participate in many conversations that happen throughout the Coachella Valley, and in fact, across the state of California, in which we are assessing opportunities that may benefit our community members. But those are separate from our grant funding. Grant funding has to be fair, transparent, and equitable, and that has been determined by the California legislature. We have to follow those rules. We have to follow the letter of the law. We do it every year, and the grant process remains fair and transparent because of our abiding to AB 2019.
Thank you. Just a reminder to those that would like to ask questions, please use the Q&A section as opposed to the chat section, but we will get to those questions that are in the chat section after we conclude with the Q&A section. So the next question is from Jan Howard. We previously received a mini grant, but now we're told we are not eligible or we were denied. How can we find out whether we are eligible or not?
Donna, I don't know if you want to expand on this topic. I think the eligibility question is answered by visiting our website. You see who is eligible and who is not eligible to apply to a district funding opportunity.
That's true. And also if it's on an individual, organization, they by all means can call and ask us. And I believe when we do our declination letter, we do put a lot of information in there as to the reasons why, but if they're not, don't understand, they're more than happy to call staff and we'll go over the grant with them.
And just to expand on Ms. Howard, she's also stating that they previously received money for hygiene kits to underrepresented students in schools. We were denied the last time that we applied. So moving on to our next question, Ken Katz. Regarding grant applications that may already be in process, do the new goals and priorities take effect immediately or with the upcoming fiscal year on July 1st?
Donna, do you want to answer that?
Right. And I apologize, I neglected to mention when I was explaining the process that if you do have a current grant that you're working on, an LOI, we hope that you suggest that you save your information, and because we are going to disable the old application, the old LOI on Friday, the 4th, and the new grant application will be going live on Monday, 3/7. So that we will begin now with the new goals, the high priority goals and strategies with this new application.
Okay, our next question is from Doug Morin. Can an organization address more than one goal in the same application?
The more the merrier, I think. Absolutely.
It appears those are all of our questions for now. If you have any other questions, if you prefer to make a verbal question, just please raise your hand and we will get to you. But those are all of our questions that we have for now.
Thank you, Andrea. I believe that this will then conclude our presentation. It has been wonderful to be able to present the new strategic plan of the Desert Healthcare District and Foundation to our community members. Organizations that are interested in our funding, they can submit their applications to our district. You will be considered. And please make sure that you're following the guidance that was provided to you today.
Thank you for joining us, everyone. This concludes our meeting.